We are back to continue talking about home safety for seniors, frail elderly syndrome, and in this part, we are going to talk about relevance and the rule of 7. You might wonder why this is important. It's important because many times when we as caregivers are trying to motivate or get our elderly parents to do something, they'll say, that doesn't apply to me. I don't want to do that. What are you talking about? So we as the caregivers have to find ways to work with our elderly parents so that they want to work with us and find ways to motivate them. I'm Pamela D. Wilson. I am your host for this program. As always, you know what's next, a little bit of housekeeping so that we can move on. I use the term elderly parent or elderly parents for the person for whom you care for. Do print out the outline for this module, the slides, follow along, fill in the blanks. Objectives of relevance, the rule of 7. At the end of this part, you should be able to combine concepts to initiate ongoing discussions with elderly parents to increase the relevance, the importance of health, well-being, physical activity, things that you would like them to do to support their quality of life, and honestly, to make your life easier as the caregiver. What is relevance? The idea of relevance is essential in all aspects of life, especially about the subjects of health and aging. Relevance means a thing, a subject, an interest, an activity that is important enough to you that you make it a priority. The thing can become important to you because it's a benefit or problem that you're trying to solve. It can be important to you because it's important to someone else. For example, a lot of adults will say, I want to take care of my health so that I can be around to see my grandchildren grow up. That is relevance. If we want to have better health as we age, taking an interest in activities to be healthy and to age positively make a difference. If health and well-being hasn't been a focus for you up to this point, that's okay. How many of you have heard the term late bloomer? A late bloomer is a person who takes an interest in a career, an education, a hobby, or another activity later in life than peers, and who produces impressive results. It's okay to be a late bloomer as long as you bloom and make health and physical activity relevant and a priority. Here's why regular physical activity supports better health and reduces the likelihood of illness and falls in the elderly. Even with this understanding, and this is why you need relevance, of the positive effects of physical activity, most people still do not engage in a simple exercise like walking because they don't relate a lack of exercise or a lack of walking to the reason that they are physically weak or sick. Why do you think this is? It's similar to a discussion of cultural diversity among caregivers. So cultures, Hispanic, Asian, European American, African American. These cultures all have very strong beliefs about caregiving, that family takes care of the family. That cultural belief for them, though, leads to women who are the primary caregivers burning themselves out and becoming physically sick because they may not have a culture that believes in taking care of oneself, being proactive about health, physical activity, well-being. If whatever culture you are from or your family doesn't have a long history of embracing healthy habits like exercise or eating healthy, or that idea was not passed down from generation, like the idea that family takes care of family, it's okay. Everybody has the opportunity to start today. Be that late bloomer with yourself, your children, your parents, to change this lack of awareness that healthy habits and exercise do lead to feeling better. So I want to talk a little bit about relevance and making health relevant. Because family life and culture really does affect our beliefs about health and well-being. And I'll share these effects in my family. So I am of Polish origin, so that would be European descent. And in my family, there was no talk about health, no talk about well-being, certainly no exercise, certainly no eating the right foods. I grew up in Omaha, Nebraska. It was very much a meat and potato society because the packing houses were there when I was young. My mother was sick from the time that I was young. Many of you know that. And there was never any discussion from her or my father about being physically active or eating well or any of that. I think my father was more physically active because he was a man and he liked to fish and he liked to garden and he liked to do a lot of things outdoors. He loved walking. My mom took care of the kids and raised the kids and was not as active because she was more oriented in the house. So as a result, she smoked cigarettes, came down with heart disease, potential strokes, a lot of bad health issues. But for me, that light switch, that switch that turned on to relevance, was seeing my mother all those years being so sick and thinking, I do not want to live like that. I refuse to live like that. So at a very early age, in my 20s, I started working out, going to gyms, researching food, researching vitamins, being very proactive about health. So that was my wake-up call. That was that relevance. That was that rule of 7 for me. And I tried to reverse engineer it with my mother. And I had some success. I got her to eat better and to lose weight. And in some senses, she was a little forced to do this because the doctors kept telling her and because she felt so bad. So if this hasn't been part of your life or your culture, it's okay. You can change. You can be that late bloomer like me who learned it later in life, but who has now embraced it for many, many years and will continue to embrace it and to talk to people about it because I do feel that it is so important. Let's talk about the rule of 7. So the rule of 7 is, it's a theory, it's not my theory. It's the idea that we have to hear, see, or talk about a subject between 7 to 20 times before we do anything about it. The rule of 7 is why you will hear me relate information from module to module, mention it in different ways, to establish building blocks that help complete this puzzle of how we can motivate ourselves, motivate our parents, and care for aging parents. Repetition of information translates to relevance. That means when we hear something or someone says something, it becomes significant to us. So if you remember the term broken record, a lot of you have never seen a phonograph, so I thought I would put a picture. This is an Edison phonograph. It's actually what played records in the early days. Now, many of you know what a record is because today vinyl records are making a comeback. So for those of us who had records, 20 years ago, do you remember that noise when you put the needle on the beginning of the record? It was kind of like this scratchy, it was just a noise. And then if you ever had a scratch on a record, it would repeat and repeat and repeat. So this is what is meant by that idea of a broken record. Repetition is like being a broken record. It's repeating and reminding the same information over and over again to your elderly parents, sometimes in different ways, or someone does that to us. I do that to you a lot in these webinar programs. Information through repetition can become significant. We can remember it more easily. Significance has other associations for us. For example, if we want to lose weight, we know that eating foods and healthy exercise is important. How do we make that relevant? How do we do this for our elderly parents and for ourselves? Now, these actions, and this is where our elderly parents come in, actions that they don't think are necessary are not relevant, and they are going to fight you. Participating in physical activity is an example of being proactive, but you may have to kick, drag, pull your elderly parents to get out for a walk. Same thing with eating healthy. If a person sees no reason to eat healthy, to exercise or focus on health, they are not going to want to do it. It's that idea of a company buying a gym membership for you and you saying, oh, hey, that's a really great thing, but you have no interest in it because you don't see the consequences. So if we do none of this today, we are more likely to have multiple chronic diseases when we're older, more days of not feeling good every day, aches and pains, at that point, it'll be relevant to us because it will be a hassle. But there's a point where we will only be able to do so much about it, so much to manage it, which is kind of where we are with our elderly parents. We see what has happened. They may feel that it's futile to try to change it. Anything that we do that improves our health, that improves our physical ability, can make our daily lives better. And this is where the idea of problems and relevance come into the picture. So we talked about chronic diseases, high blood pressure, high cholesterol, diabetes, things that require prescription medications. If we don't ask the doctor about how to manage the conditions or to prevent them from advancing, we stay at that square one. We're just going to get worse. We know this now. We know this. Most doctors, because of time constraints, don't offer educational information about disease management unless you ask. Patients, consumers haven't been taught to be proactive in asking questions. So we know that taking a medication, for example, high blood pressure medication, we might be able to not take that if we exercise, lose weight, eat better. Sometimes we may have some hereditary factors, but that is a very low number. So in a lot of cases, we know what we should do, but we don't do it because that situation isn't bad enough yet, which leads to the question of why do we have to be pushed before we take action? Part of it relates to our personality type. We might be that person who just sits back and waits for life to happen and waits for it to get so terrible that we have to do something. Or we might be the person who's like, okay, I'm going to take care of this. We can learn, and I'm a perfect example of this, the importance of being proactive by witnessing the life experience of others, like watching my mother suffer and die at the very young age of 69. Totally unnecessary. Here's another example that you can relate to. Let's say that your supervisor gives you a verbal warning about losing your job because you're not doing your job. All of a sudden, you become more interested in doing your job so that you can keep your job. If you don't like your job, you might start looking for another job. But in the meantime, you want to be able to do your job to avoid the idea of being fired. So that becomes a motivating factor. While it shouldn't take something like that to motivate us, sometimes it does, which leads us to the next subject, which is procrastination. So let's relate procrastination to being a caregiver for an elderly parent who is uninformed or not proactive about health. Today, your elderly parent has several health issues. You watch them struggle physically. They don't feel well. Mom or dad complains about their health, but they're still not doing anything about it. You think about saying something, but you hesitate because you don't want to have an argument with your parent. So you do nothing. Your parent falls down the steps. Now you are a caregiver responding to a hip fracture, surgery, rehabilitation, and more time being a caregiver. Wanting to talk to elderly parents about health concerns, now that you know the risk is a choice that you have. Sometimes we procrastinate in talking about uncomfortable subjects because we're afraid of failure. We don't want to be rejected. We don't want to have a major disagreement with elderly parents. But if we do nothing, it's only going to require more of our time. And the health of our elderly parent is going to get worse. But we wait because that poor health isn't a big enough problem yet. It's not a priority. Doing something about it seems like too much trouble. So let's relate this to the coronavirus, which many of us now are familiar with. There are aspects of life that have changed significantly, some temporarily, some forever. The stock market's down, but it's going to come back. The health of many people was affected and will continue to be affected. Some people had the disease, recovered. Some will have some lingering issues. We all know that health issues, once they happen, are usually not reversible, but they are manageable. This is why until the health of an elderly parent becomes a big issue that is consuming caregivers' time, a lot of times caregivers just don't do anything about it. But that waiting to act has unexpected costs. It results in more work and stress for the caregiver in the long term, and it affects relationships. So think about this. You watch your elderly parent, they don't feel good. Caregivers suffer from physical and emotional stress. Do you really want to be in that position that your parent is years from now of not feeling good? You don't have to realize or think that this is just the way it is and that you have to live with this or that your parent has to live with this, because my favorite saying, being old and sick is a choice that we make. That idea that we become less physically active with age, a lot of people think that's true. It is not. We can choose to stay young in mind and body. Many of my clients, I've seen them do it, or they can choose to be frail in mind and body. Physical well-being is a choice that we make early in life that can change with time as our bodies age and we become disabled by injuries or being physically inactive. The issue of being sedentary, sitting around, being inactive, sitting all day, it is very widespread in the elderly population. Research confirms that huge number, 93.6% of older adults sit for 8 or more hours a day. That means seated in a reclining position, not doing anything. Now, it's very different from you who goes to work. So imagine how you would feel if you just sat in a chair for 8 hours a day. Would you feel stiff, achy, weak? What would your mental activity feel like? A lot of people, we work at desks all day, but we get up to walk around, we go to lunch, we're active outside of work. Getting up and down occasionally, moving around is very different from an older adult who sits in that chair all day, watches TV, and doesn't get up to do a single thing. I'm not like them. There is research out by Maswan that confirms that older adults view being called sedentary as negative, even though they willingly admit that they sit around all day. There's a theory about that, which is called social identity theory, which we'll talk about a lot. But it confirms that people don't want to be associated with groups or actions that have negative consequences to health or lifestyle, even though their behaviors put them in that group. Is that denial? Perhaps. It may be part of elderly parents wanting to think that they are more able than they are. Understanding the foundation of social identity theory and this behavior is important as a caregiver when you are trying to change elderly parents in their behaviors. It's helpful really for all of us to understand why we resist or refuse changes. We usually see change as relating to work or effort and not having any benefit, so it's not relevant. So what do we do about that? Well, in situations where we act in ways that might be perceived negative, a lot of us look for any association or benefit of our action. So we look for excuses. We look to excuse behaviors, mistakes, or situations that didn't work out how we expected. Now, if we were honest and if we would search for reasons, it's not positive to rationalize behavior. So looking to justify negative responses has different underlying causes. Some behaviors are lifelong, so they're difficult to change. That's why caregivers can struggle to help elderly parents or spouses who've been like this all of their life. The positive in this is what we want to avoid when saying, well, this is just the way I am, or I've been this way or all my life, or, I'm not going to change. If we can look at our behaviors from a point of, okay, it caused this. It was harmful, it was unhealthy, it was questionable. So a lot of times we'll rationalize behaviors to maintain our self-esteem to make us feel better because we don't want to think that we did something bad or harmed somebody or harm somebody else. So we do our heads in the sand. Self-examination is difficult for everybody, but especially for our elderly parents who may have lived this way all their life. And I'll give an example. So a client of mine a long time ago had severe heart disease and smoked cigarettes and came down with lung cancer. And the person used the cigarettes as a mechanism to relieve stress. So whenever somebody said, oh, you should quit smoking, it would be like, oh, I'm so stressed. I need the cigarettes for stress relief. So lung cancer, progression, chemotherapy, treatment, all of that. During all of that, still could not give up the smoking, made the choice not to give up the smoking. and passed away because of the smoking. Members of this person's family are still angry with that person to this day for smoking, for not giving up smoking, and for dying unnecessarily at a young age. Sometimes, though, we have addictions, whether it's to cigarettes or alcohol or something else, and it's hard to give up. We don't see the motivation. Another person I knew who was an alcoholic said, I'm just going to quit. I want to live. Living to me is more important than having a drink every day. This person quit cold turkey and never looked back. So it's all in how we approach change. And if we can accept that this wasn't a good idea, it was harmful, I shouldn't have done it. And then how do we change it? So how do we get from I'm never going to change to this is more important to me, I will do whatever it takes to change over a period of time? That's the idea for ourselves and for our elderly parents that we have to figure out. When talking to elderly parents, if you talk about that gap and explain how that behavior affects their daily life and the way that they feel, and then you can explain choices and you can be empathetic and say, Mom or Dad, I realize you don't feel good. Do you realize how this affects me and my family and my career and my job? I have a book out there. It's called The Caregiving Trap. Elderly people feel trapped by bad health and choices that they made and the fact that they need help from children. Caregivers feel the opposite. They feel trapped by having to respond to lifestyle choices made by parents. They feel trapped because elderly parents refuse to change, and those behaviors are going to affect their lives. If we can think about change as how change affects me and how it can be positive and positive for my relationships, that's one way to take that step forward. The other part of rationalizing things is blame. Nobody told me that. The desire to believe that we don't fall into these patterns or behaviors that aren't good for us really leads us to the idea that it's okay to blame others, to say, nobody told me that. Or to say, well, who told me that smoking could result in heart disease? Who told me that smoking could result in lung disease? Seriously, it's all out there. Even the importance of physical activity is out there. So saying that we don't know is a choice that we make. When a serious diagnosis happens, research proves that the likelihood of a change in behavior of that lifelong habit to lose weight, stop smoking, stop drinking, eat better is very low unless there is that significant motivator, as we talked. I want to live to see my grandchildren grow up. I want to live. I don't want to let alcohol or cigarettes end my life. Even then, I know that it's very difficult for people to be able to do this. You know, with chronic disease, there is no magic cure for the diagnosis. And if you think of having a chronic disease as an opportunity to make positive effects in your life. So a lot of people with chronic disease will say, oh gosh, you know, I feel like I've lost part of my life, that healthy part of my life, that part of my life where I could go do all these things and now I can't. I don't have that anymore. And so we do have a choice, and it's important to look at these choices and to help our elderly parents make these changes. In the module called Daily Monitoring, we take a very deep dive into all of the steps that it takes to manage chronic disease for ourselves and for our elderly parents, and how we combine medical care with that, lifestyle changes, caregiver and family involvement, attending support groups, and how to make these life-changing decisions, because it is important to the success of care and caregiving relationships. This is a favorite client of mine. Her name was Loretta, and I have a cookie on this slide because she had probably 200 cookie cutters in her kitchen cabinets, and she was so amazing. I met her years ago, and she was a client who I met. Her husband had just passed away. And her life story was they were a military family. He was in the military. They traveled all over the world, loved God, loved country, loved making cookies. She had so many health conditions. She was type 1 diabetes, which means she had to take insulin. She had kidney problems. She had macular degeneration. She couldn't see. She had neuropathy in her feet, difficulty walking around. I mean, so many health problems that you think this woman should have like been in bed and stayed in bed all day. Did she? Absolutely not. This is my Energizer Bunny story of one of the most amazing people I've ever met in my entire life. The everlasting legacy that she gave me was to convince me to become a member of the American Legion. Now, if any of you are members, you know that you need to have someone in your family who was in the military. My father was a World War II veteran. This lady used to go to American Legion meetings, and one time her caregiver could not take her, so I took her. She made me go and she made me apply. That is one of her legacies. The other legacy is just watching her indomitable spirit. She made cookies and she would take them to the fire department once a week. A caregiver would drive her because obviously she couldn't see to drive and shouldn't have been driving a car. These firemen look forward to seeing her every week. It was like the bright spot in her day. Of course, they appreciated the cookies and they loved her very much. But that gave her motivation to keep going. She even made goodie packets and she donated them to charities for women who helped women get jobs. It was very important to Loretta to remain active in society, even as old as she was. She was in her late 80s, late 90s when I knew her. She didn't stop going. She got up every day. She had a reason to get up every day. She was amazing. How many of us would like to be like that, minus all the chronic diseases? If your elderly parents say, I can't do that, I feel bad, seriously, find amazing people who are older who are doing unbelievable things. It's possible. Again, you know what? We don't have to be old and we don't have to be sick. Let's talk about how beliefs, how what we think affects our health and well-being. So even with health problems like my client Loretta, we make our life what it is. Our thoughts are everything. Our brain really is a computer, and we can choose to hold positive thoughts and send those negative thoughts away. There are studies out there that follow this who say that aging adults who had low expectations about their health, so didn't really expect it to get better, were very honest about the fact that they didn't physically exercise. Because from a conceptual standpoint, they knew that exercise would make their health better. So they weren't going to make up stories about it. Now, on the other hand, adults who expected good health were not always honest about the level of exercise that they did. So a lot of them believed themselves to be more active until the activity was measured. So an elderly parent might say, oh yeah, I got out 3 times last week. And then when really looked at it, well, maybe they only got out about once. So for caregivers, if you can identify these gaps in health and well-being in daily issues, and especially when you take your parents to the doctor, you can then pose a level of importance by saying, you know, mom or dad, the doctor says this would be good for you. Why can't we try to go out and walk? Why don't we try a little bit of exercise? So the beliefs of our elderly parents who want to believe that they're healthier, that can have good and bad consequences. So if we have high expectations about being healthy, maybe we're more likely to exercise or eat healthy or take care of ourselves. But when we think that we're healthier than we are, then we get into these gaps where we're not doing what we should. And so for caregivers, coming up with these simple steps. So a simple example of a step-by-step plan would be to talk your parents into making a healthy breakfast every morning, doing the dishes, and immediately before they do anything else, go out and get that walk in. That would be one significant step forward to build a physical activity routine to achieve better health. The other thing is just being with people like us, like minds support change. Change is more comfortable when we talk to others in caregiving programs like this one. Support groups make it easier for caregivers to share stories and to learn from others who are helping elderly parents and spouses. When we get together as caregivers, we share the wins, the defeats, the battles, all the steps that we take, and we gain a different perspective. And I know this from my groups, but caregivers are pretty brutally honest with other caregivers, sometimes darn blunt, because they want to help you avoid any struggles that they have experienced. Proactive caregiving groups focus on situational realities. They'll tell you like it is. They'll tell you what it is. Caregivers shouldn't ever feel embarrassed to disclose personal situations or to ask for help, because by looking at that idea of what can we do to make the situation better, we close those gaps between our worries today and a better future. We all have gaps. Our parents have gaps. It's part of life. What are yours? What actions are you willing to take to close the gaps? Who can you engage to help you? Is it another caregiver, your elderly parents, a spouse, or children? These gaps can support and improve our family relationships. So let's just summarize relevance and the rule of 7. Relevance is that idea that we have to be exposed to ideas between 7 to 20 times before we do anything about it. Making health, well-being, and understanding the responsibilities of caregiving are important to help us be proactive. A lack of relevance is the reason that we and our elderly parents can be closed-minded to suggestions. This doesn't mean that we ever give up. With my mother, even though she had all of her health issues, I never gave up. I was always that cheerleader. We have to be that cheerleader for ourselves and for our elderly parents, because things can get better. I know sometimes it feels like it is impossible and you cannot possibly keep going. Yes, you can. Be that Energizer bunny. Be like my 90-year-old clients who were amazing and never stopped going. I'm Pamela D. Wilson, caregiving expert, advocate, and speaker. Thank you for joining me for this webinar. I look forward to being with you in another webinar. It's my pleasure to be here and to share this information with you.